Okay, we have accomplished stim, ultrasound. Now what happens when you want to bring them together? And that is very possible with this machine. What you're going to do, first of all, is to take your lead wires and plug the red set of lead wires into channel 1. And you're going to take the white lead wire and run it over to this small little pin jack that is next to the ultrasound, and that is how we're going to deliver the stim into the transducer so that we can do combination. And the red lead wire, you're going to put an electrode on it and put it anywhere on the patient's body. That then will complete the circuit. Okay? Then, to operate the machine, you're simply going to do everything just as you've done it before. First of all, setting the stim side first. So let's say we want to do a high volt treatment. We're in channel 1, going to turn up our intensity, and the patient should start to feel the intensity coming out of the transducer. I might note that stim will come out of both ends. So if you're running it like this, they're going to feel it here, but should you touch up here, you would actually feel it here. And of course, you're not using that much intensity. So you're going to run that up. And once you have that set, you're going to accept it, and now that's all locked in. Then you can come over here to your ultrasound side, applying your aloe vera, your ultrasound lotion, keeping it moving as you begin to turn up the intensity, and turning it up. So I'm going to be moving the head, and then hitting your start button. And as long as this ultrasound active light is on, and like we said before, the time in minutes is flashing, you are running. So now I should be receiving, if I have the other lead wire hooked up to somewhere on my body, I should be receiving a combination therapy in the transducer, coming out of the transducer head here. And I'm just going to turn that off. So the combination therapy with the CM2, the WINNER series, can be done in any mode. You can have a combination. The only thing that I think I left off previously is that you can do anything you want on the fly as far as adjusting your intensity. So a lot of times you will get an accommodation, patient will say, I don't really feel that. So let's go back and let's go backwards and talk about that. If right now I'm at 9 milliamps, and if I wanted to increase that because I've accommodated for some reason, all you need to do is to first hit the channel button to make sure we're dealing with the right channel. We don't do something with different patients. And then hit the, and then you will see this adjust light will be lit up, and you should then be able to turn the intensity up to increase it until the patient then begins to sense that they feel it, and then lock it in with the accept button, which flashed when I turned that on, and you'll notice the adjust light is no longer blinking. So to change our intensity on the fly, first hit the channel button, and of course if I had channel 2 going on another patient, another part of the body, I'd hit that one if that's the one I wanted to increase. Hit the channel button, the adjust light will blink to let me know that I'm okay to adjust, and then watch my window, my intensity window, and it will go up. And then hit the start button to lock it in. The other thing that we didn't talk about on the stim side is that you do have a view or adjust pulse rate. You can do the same thing with pulse rate. If I hit this button and I light that up, now my intensity disappears, and now I'm dealing with my pulse rate. And right now I'm at 100, and I can turn that up with the intensity key to, let's say I want to adjust it for some reason on the fly, turn that off, everything comes back, and now I'm running again. Okay, so just as a quick review, the profiles down the side allow you to set up 4 primary treatment protocols that you or your facility cohorts, the people that you work with, use on a regular basis. The concept being that when you approach the machine, you know that profile A is possibly your 2-week ACL stim, or your edema reduction, or your pain control, or whatever you want to make it. You hit that button once, everything is set up as you want, you know it's a high volt. All you need to do is to place the electrodes on the patient, turn up the intensity, hit the accept button, and walk away. Go on to your next patient or the next thing that you want to do. It's meant to be that quick and that easy. If you want to change those parameters to lock something else in, you simply hit that profile button twice, then choose what you want to make it. Let's say it's pre-mod, and we want it in a normal, and we want a fixed pulse rate. Everything's locked in. Hold down the, and then you have to at least get 1 milliamp on the screen as far as our intensity goes. And then it will allow you to lock it in by holding down the accept key and listening for 2 beeps. Now, no matter what I do down here, when I come back to Profile A, it will be that pre-mod that we just set up. If you don't like anything that is in the profiles, you've just returned on a Monday morning from going to a course on Saturday and they gave you the greatest, best new protocol, you simply approach the machine and choose whatever waveform you want and set up everything manually and go. The only thing we didn't talk about that I had promised was to just explain a little bit more about the pre-modulated. Pre-modulated interferential versus the quad-polar interferential. Quad-polar being our button furthest to the left. Quad-polar interferential requires both channels. When you turn it on, if we choose that, you'll notice that we're going to actually have channel 1 and channel 2 lit up. And so both of them will light up here. So I'm going to then place channel 1 pads, then channel 2 pads, generally in that crisscross formation. And I am then going to turn up the intensity on each channel separately. And wherever that intersection is based on bone, fat, tissue, wherever that intersection is in the body, and you can't always tell, that's, or wherever those 2 waveforms cross, that's where the intersection will be. The difference is with pre-modulated is we're going to pre-modulate the waveforms inside the machine, and so that you know that that waveform is running in between those 2 pads. And generally interferential is putting a less comfortable waveform, writing it in with a more moderate waveform, a medium frequency waveform, in order to get that pain control or the muscle contraction or whatever it is that you're specifically looking for, so we can get more power and more energy in the interferentials than sometimes just a high volt. Okay, so again, any questions? 800-577-5694 or feedback@pttalker.com. Want to remind you that we do operate a podcasting site at www.pttalker.com, where we interview experts in the field of physical therapy and trying to bring you business news and ideas that help you grow your practice. My name is Jeff Worrell. We're always here to help, and hope that you will contact us should you need anything else in the future or any unique and innovative solutions to problems you might be having as far as equipment or supplies for physical therapy.